So Jack and I are going to be talking about heel pain this morning as part of the Pods Heals Heals campaign for 2024. And we're featuring what the different causes of heel pain are and what to do about it.
Yeah, I mean, obviously heel pain, it comes in a lot of different varieties. You get a lot of different feelings, sensations, pains, things you can do with or without the heel pain. Sometimes you can still do stuff, but it's annoying. So it's just when to see someone and to say that we're podiatrists, we can deal with heel pain.
And in addition to that, I think that a lot of people think that when they have heel pain, that it's plantar fasciitis. But the reality is that there are, 26 plus.
There's a hell of a lot of conditions
there,
for heel
there
pain.
really are that can cause heel pain, and they have different causes, they have different treatments. So when people have gone to a practitioner for plantar fasciitis treatment and it hasn't worked, often as not, it's because it's something else that's going on there.
And it's a different treatment.
Absolutely.
So you can't fix it with that. But yeah, you end up having lots of different pains that kind of sound like plantar fasciitis. You Google it and apparently that's what it is.
Absolutely. Dr. Google at his best.
Yeah. Cool. So yeah, Pods Heals Heals event that we went to earlier on in the year. It was a great day of learning just how we can incorporate this kind of event into what we do as podiatrists. People know that we deal with heel pain. It's not something people think about really.
Yeah, no, absolutely. And I think that getting everyone in the same room and giving them an opportunity to really focus on just this campaign and spending a particular time of the year reminding people that if they've got heel pain, the place to go is a podiatrist.
Exactly.
First and foremost.
You want to be going here straight away. When you get heel pain, it's always easier the sooner rather than later that you deal with it. Sometimes, I mean, on the lower scale, it can be stretches and whatnot, which is great. Later on down the line, it's just a lot more invasive to deal with.
Yeah,
that way.
Absolutely. The longer it takes to start treating it, the harder it is, or the longer it takes to...
A bit more taxing on the patient. Well, everyone really, but a bit more taxing on the patient.
Yeah.
So it's always easier sooner rather than later.
Yeah.
Always.
Yeah, absolutely.
When you have pain in your heel, obviously people completely think it's just plantar fasciitis. In the past, we've seen heel spurs, which a little bit of bone growing underneath the heel can be very painful, can cause a lot of bruising. People then come in with the painful bruising. If they'd got it done sorted earlier on, it would have saved them a whole lot of pain and a lot of inconvenience.
Yeah, interestingly, heel spurs is an interesting one because when they do MRIs or ultrasounds, almost every case of plantar fasciitis has a heel spur involved, but the heel spur isn't always the problem. And then people think their heel spur is a problem, and you hear of people who have actually had surgery on their heel spur when actually it was a plantar fasciitis that was the problem. Now, we say plantar fasciitis, that in itself is a debate, because is it plantar fasciitis or plantar fasciosis? Yes. And actually, we're not going to get into that debate today. We're going to call it plantar fasciitis because that's the generic term that's
what people know.
People know, absolutely.
Yeah. So when people get heel pain, the best thing to do is go straight to a podiatrist. We specialise in the feet. We know feet, so it makes sense for us to be the first people to go to. We have a range of things that can help. I mean, orthotics, we've got shockwave, obviously no stretches, strapping, all things that can help to try and sort out this heel pain. Always better just to come to us first.
Yeah, I think you're quite right, Jack. What we're really good at is knowing what stage your heel pain is at. So what treatment you will need at that particular stage. And as you just mentioned, we'll have a range of treatments. We'll start with the simple things.
Yeah, got a pathway.
Absolutely. We've got a really clear pathway that goes right through, starting with those stretches and just if it's acute, if it's just happened, we've got some low-level laser or shockwave to get rid of that pain. And then if it's been there a very long time, then the orthoses. No, I was about to say steroid injections. We actually don't usually use the steroid injections these days for heel pain because the shockwave is so effective without having the risks that go with steroid injection.
Exactly. If needed, we can do it.
Yeah, within our practice, we tend to not need to do that anymore. So obviously, if you get heel pain for the first time, the first line of attack is icing and doing the stretches. And
Resting,
Dr.
yeah.
Google will tell you that. They'll say that on the NHS website. That's the easy stuff. It's really, if something's still there after 2 or 3 weeks,
Or it's getting worse.
Or it's getting worse,
Yeah.
absolutely. And, you know, the classic thing with plantar fasciitis is this pain first thing in the morning.
Yeah.
And if you're not got pain first thing in the morning, it's not plantar fasciitis. Well, it's unlikely to be plantar fasciitis. Yeah. Now, things that aren't plantar fasciitis also give you pain first thing in the morning. Plantar fasciitis is the one that does give you pain first thing in the morning. If your pain is in the evening or at the night, then it's not plantar fasciitis, likely as not.
Exactly. If you're dealing with foot pain, stopping you doing anything, changing any aspect of your life, it's always worth coming to get it treated. We know Heel Pain here. We have a lot of stuff here that can help. I would always just say, come get your feet sorted. They go through a lot.
Yeah, absolutely. So we've actually got a lot of information about heel pain on our website, and we've done a couple of blogs about them as well, I think. Blogs. And so if you need any more information, our website is www.dulwichpodiatry.co.uk. If you need any help, you can book through our website directly or phone the team on 0208 693 6000, and we'll be very pleased to help you.